In the summer of 2022, Canada experienced a tridemic caused by ongoing waves of the Omicron COVID variant, a spike in RSV among children, and an early start to the flu season with a strain of influenza B that particularly affected kids. This caused an unprecedented demand for children's pain and fever medication in the forms of acetaminophen, most commonly known as the brand name Tylenol, and ibuprofen, most commonly known as children's Advil or Motrin. It's also worth noting that over the first half of 2022, most public health measures across Canada, except voluntary vaccination, were abandoned. In August of 2022, Sick Kids Hospital in Toronto recommended parents get prescriptions of those medications to ensure supply in advance of the flu season, even though they are non-prescription over-the-counter medications, and a prescription would not ensure supply if the pharmacist was out of stock. By the time that the Canadian Pharmaceutical Association was able to get out a rebuttal, mass hoarding in advance had already begun, emptying shelves in Eastern Canada and causing a 53% increase in sales in U.S. pharmacies along the border. This caused a nationwide shortage of these two medications heading into the fall respiratory virus season. To make matters worse, the 2022-2023 influenza season started in October, roughly 6 weeks earlier than expected. As soon as pharmacies got stock, people would clean out shelves to stockpile it at home, even if their kids weren't sick. In September of 2022, Health Canada began working with global manufacturers to adapt their products for the Canadian market. By November of 2022, the federal government had approved the import of 9 brand name products from the United States and Australia, resulting in the import of over 4.4 million units over the winter. In parallel, Canadian manufacturers massively ramped up production of these medications under brand names trusted by Canadians, releasing 13.9 million units by May of 2023. Normal demand across Canada for these medications is 300,000 to 400,000 bottles per year. There is no question that the combination of sudden surge in illness in 2022 plus the hoarding emptied retailers' shelves. But as sharply as that pediatric influenza B spike began in October, it fell in November and largely ended over Christmas. It became obvious over the month of November that Health Canada, pumping the market with imports 10 times the annual demand from multiple manufacturers and countries, would catch up to the market by year-end, especially with the drop in pediatric influenza and the related calming and hoarding. Nonetheless, on December 6, 2022, Premier Daniel Smith and then Health Minister Jason Copping announced that they were signing a deal with a Turkish company, BreakdownAB Pharmaceuticals, for 5 million bottles of children's acetaminophen and ibuprofen to supply to Alberta pharmacies at the cost of at least $80 million.
Your government is taking action to help provide the medication Alberta families need. I'm happy to announce that we have secured a supply of 5 million bottles of children's acetaminophen and ibuprofen for Alberta families. Right now, your government is working with Alberta Health Services and Health Canada on the details and logistics to import this medicine. And you can feel confident that we are all moving as quickly as we can so that Alberta families can get what they need. And it will be available at your local pharmacy in short order once it arrives.
They claimed this medication would be available for import in a few weeks if Health Canada practiced the spirit of cooperative federalism. They also claimed parents would be able to keep their kids out of the hospital if they could buy the medication in pharmacies.
I think one of the reason for this announcement is to make sure that we are providing parents with the medication they need so that they can treat at home and ensure that they can break the fever at home. That's the most important step we can do to keep the pressure off the hospital.
It's important to point out that during this shortage, many physicians issued public statements that while these medications provide comfort care, they aren't life-saving, and they don't halt the progression of a virus. They manage the symptoms. Copping falsely claimed that there was no manufacturer in Canada, even though Johnson & Johnson manufactures their version of these products in Guelph. Copping also falsely claimed Health Canada had approved the raw ingredients from the Turkish manufacturers, but not the final product. Again, the manufacturer was BreakdownAB Pharmaceuticals of Turkey. This is the Turkish Tylenot, which, to be absolutely clear, is nothing more than a little bit of clever wordplay based on alliteration. There were problems from the start. A few of them were pretty funny, most of them were entirely predictable, but ultimately they were all just infuriating. To start with, Atabey is the company that was started by Dr. Oz's family. Yeah, this Dr. Oz. So the jokes on that front pretty much wrote themselves. Alberta has about 700,000 children under the age of 12. The Alberta Pharmaceutical Association claimed they could use about 500,000 bottles if received in December as promised by Smith & Copping, but did not commit to buy any. While Alberta was ordering more bottles than the entire population of the province, 5 million bottles, Premier Smith and Health Minister Copping were confident that Albertans wouldn't be on the hook for the surplus and that Alberta would be able to sell the bottles to other provinces. For additional context, 5 million bottles is about 10 to 14 times the entire national demand for children's pain and fever medications. Between imports and increased domestic production, Health Canada brought in over 18 million bottles that winter. Surplus inventory after the winter was more likely to be a problem than a shortage. Out of the 80 million total budget, the government of Alberta committed to purchase 70 million worth of meds at $14 a bottle, which is about twice the wholesale price and way more than retail price. The other 10 million was for unspecified internal costs. Copping admitted that Alberta taxpayers would have to subsidize the price to other provinces to match their wholesale prices. That wholesale cost of $14 a bottle was and is significantly more than the normal retail cost of the trusted supply that, again, had already seen a huge manufacturing increase a month before this deal was even made. The problems continued. The Atabey dosage was not the same as the North American dosage, which is a safety issue triggering advance warnings from pharmaceutical colleges as well as Alberta Blue Cross. Because of this reason, the Atabey products could only be imported by exceptional import in a process requiring attestation to the shortage by Alberta's Chief Medical Officer of Health. But there was also the problem that Atabey hadn't supplied medicine to the Canadian market, and their products that Alberta taxpayers had just paid upwards of $100 million for did not meet Health Canada specifications in many ways. Dosage, child safety caps, warnings, dosing devices, packaging, labeling, and more.
We have a statement from Health Canada that says they received proposals by Alberta for the importation of children's ibuprofen and acetaminophen for use in pharmacies, and that a decision was provided to you guys in December. What exactly did that decision say?
There's a couple of things that we had to do in working through with a new supplier. The Health Canada has to go through and examine the manufacturer. They have to examine our import facilities. We had to make sure that the formulation was the same as we would sell for generic products here. We had to get French and English packaging approved. And we went through all of those different steps, and so as a result, we have our first shipment arriving on the weekend. It's going to be for Alberta Health Services use. It's 250,000 bottles. The remaining 4.750 bottles is 4.750 million bottles are going to be subject to an additional delay because for retail use, you have to have a child-proof cap. As I understand it, we are working on making sure that that approval process is taking place, and so that'll be the second batch. And as soon as we know when the retail use is going to be available, we'll do another press release. But the good news is that our Alberta Health Services hospitals will have the first shipment by this weekend.
Well, I'm talking specifically about pharmacies. So those are supposed to be on the shelves by Christmas is what you guys said. They aren't on the shelves. So I'm just wondering, so how I understand it is that it was actually rejected, that proposal in December, and then you had to put forward a new proposal. Is that correct?
No, it was just a process we went through. I mean, we respect Health Canada has a role in making sure that we have the safest product possible on the shelf. And the issue that they had was that when you make a product available for a retail use, it has to have a child-proof cap. So we're just working with the manufacturer to make sure that that is in place so that we can make it available for retail use. And look, I don't want to rush Health Canada. Certainly want to make sure that people, as soon as the supply arrives, that they feel confident in it. It really was just a matter of us meeting the regulatory conditions, and that was the last condition we needed to meet.
So So you had to put forward a new application.
We've been working with them right from the beginning. We always knew that we would have a certain amount that would arrive that would be for AHS use, and then we had to continue working with them to make sure that we had the bottling that met their specifications. One of the specifications was we had to make sure that it was listed in the same familiar type of formulation that we have in Canada. We had to make sure French and English labeling, and this last hurdle is we just have to make sure we've got the childproof cap. So it's been a process that we've been going on. It's just taken a little bit longer than we expected, but the first shipment is arriving this weekend for Alberta Health Services.
Just to confirm, this is the same application that came back in December.
I've been working with this on this all the way along. We have been working with Alberta Health, with Health Canada to make sure that we were meeting all of their compliance. It's a brand new supplier. There's just a couple of hurdles that we needed to get through, and we're almost on the last one.
The medication itself didn't even start to arrive until January, but because of issues with the labeling and the dosing, that first shipment of 250,000 bottles could only be distributed to Alberta hospitals, where nurses could be trusted to perform the extra work of converting the dosage before administering the medication to patients. Medication for the public to purchase in pharmacies didn't arrive until late March, 2 months after Health Canada allowed another exceptional import and well after the shortage of the trusted brand name supply had been resolved. The medication had to be stored behind the counter as the pharmacists were required to teach parents how to adjust the dosage. But the problems didn't stop there. Because of the delay in the shipments and the wrong dosage, no other provinces had any interest in buying them. Also, since Health Canada has not provided regulatory approval for any BreakdownAB product at a national level, any other province could only get them on a case-by-case applications to Health Canada again for exceptional import, which again would require a shortage. Alberta was ultimately only able to import 1.5 million of the 5 million bottles purchased because the shortage justifying the exceptional import had ended, and Health Canada never provided approval for anywhere other than Alberta. New Health Minister Adriana LaGrange directed this massive overbuy to Alberta hospitals. This inventory was dumped into AHS books, even though AHS never had a shortage, had its own suppliers through 2022 and 2023, and the original stated intent for these medications was that they had been purchased for retail sales in pharmacies. Perhaps most concerning, though, the medication that was distributed to hospitals for use was only approved for ages 2 and up. AHS determined that because of its consistency, if used with newborn babies in the neonatal intensive care units, it could place those newborns at a risk of a condition called necrotizing enterocolitis, which literally kills the intestines of infants when used through feeding tubes. Alberta Health Services discontinued the use of the medication entirely. Fortunately, nobody was hurt. All told, Alberta hospitals only used the medications for only 2 months before returning to its already established supply. But that only further underscores the question. If the medication was originally purchased with the intent to be distributed in pharmacies for the public to buy, why was it ever redirected to the hospital supply, if not just because Smith needed a cheap victory lap? Alberta only received 1.5 million bottles of the 5 million bottles that the province paid for. Of that 1.5 million, only a total of 4,700 bottles made it to community pharmacies for the public, and only 9,000 bottles made it into hospitals across the province. Alberta ended up paying to store the rest of the medication and has no means by which to get back any of the money spent, which means that, in effect, given that only 13,700 bottles ever made it into any kind of circulation, Danielle Smith paid $5,839.42 per bottle using taxpayers' money. We call it Tylenot, but what was the official name of the medication? Appropriately enough, payroll. Or maybe it's parole? We like payroll. Although the government tried to hide the existence of a middleman, who allegedly orchestrated this entire deal and has since been confirmed to be the importer, MH Care Medical, the company owned by Sam Raish. They received the $70 million from Alberta Health. It is unknown how much of that they paid to ADABA for the 1.5 million bottles actually shipped. It's also unknown whether the 5 million bottle minimum purchase was required by ADABA or by MHCare Medical. Even after the safety debacle with the masks and the PPE, the government still decided to use Mauritius Company in a sole-sourced contract through AHS to obtain children's medication. The products never received regulatory approval. They had the wrong dosage despite a custom manufacturing run, and multiple shipments were required to get the safety caps and labeling right, seemingly by trial and error, requiring secure disposal. Again, all paid for by Alberta taxpayers. Some have since speculated that individuals within the UCP government had attempted to purchase the 5 million bottles of ADABA product through Maurice in order to bootstrap MHCare Medical into the role of being a national distributor of pharmaceutical products, starting with the children's acetaminophen, in the hopes that there was still a shortage when the imports finally arrived. But taxpayers carried all the risk of that minimum buy, of the failure to meet the regulatory requirements, and of demand drying up by the late arrival of the product, all of which occurred. It was an entirely predictable $80 million catastrophe. The mismanagement of the government and MHCare Medical caused both the government and MHCare to fail at establishing MHCare as a distributor of pharmaceuticals, assuming that was their goal. To this day, they only have a Health Canada license to import and not to distribute or retail, and do not list any pharmaceuticals for sale. Let's use a recent example of how inconsistent all of this is with standard practice. Earlier in October of this year, Jennifer Lee at the CBC revealed that Adriana LaGrange had let the vaccine distribution contract to physicians' offices with a well-established company, Accuristix, expire in April of 2024 without any extension or replacement. Alberta Health did not even put out a request for proposal or RFP. This meant that physicians had not been able to administer even Alberta's schedule of routine childhood vaccinations for 7 months, and now couldn't provide the fall 2024 flu, COVID, or RSV shots either. When questioned about this, LaGrange gave the excuse that the incumbent distributor had unspecified quality and safety issues.
So the contract with the distributor expired months ago, sort of back in April. And the government's request for an expression of interest was posted in August. So I'm wondering why it took so long for that to happen, for steps to be taken to find a distributor so vaccines could go to these clinics in time for the fall immunization campaign, and so that doctors could distribute other publicly funded vaccines as well.
Well, my understanding is that the reason why the contract was not renewed was because of quality and safety issues with that particular distributor. And so there is a process that we have to go through in government to have a competitive RFP process that has to be gone through. And so that has been gone through. And my understanding is that at this point in time, we are looking to supply those roughly 250 clinics with the product, but we have over 2,000 access points for immunization that are available across this province. Those clinics represent roughly about 5% of the overall immunization that we provide across the province, and it is very important, and so we are working actively to make sure that they do have product via a different route. But at this point in time, as I say, the contract did end with that distributor because of a safety and quality issue.
Lee asked the rejected distributor about this, and Accuristix explained the only issue they had over 3 years of delivering over 800,000 doses of all vaccines was a temporary issue, with 1% of the COVID-19 doses having a rise in temperature above the ultra-cold storage requirement. These doses never made it to the public. Accuristix refunded AHS for the cost of the storage, and AHS continued to work with Accuristix after that. So one has to wonder, if the vaccine distributor was not provided a chance to renew or bid on a new contract because of an issue with 1% of the doses that never even reached the public and didn't cost taxpayers any money, How is it that Samrace and MH Care Medical keep getting more contracts after their Vanch masks failed to meet the required ASTM standard? Most of them wouldn't fit or hold any shape, and many of them caused breathing issues and skin rashes in healthcare workers. And after 100% of the children's acetaminophen product failed to have the standard dosage, was never approved by Health Canada outside of exceptional circumstances, was months too late, and effectively cost $80 million to only get 13,700 bottles to hospitals or pharmacies. Why the massive double standard?